Hello, welcome to the McPaws Foster Kitten Care slideshow. We are so happy that you're here to learn all about our kitten care, fostering kittens during kitten season, and in this slideshow you'll see plenty of cute kitten pictures. I'm Alex. I'm the assistant manager here at McPaws Animal Shelter. I've been with McPaws for a few years now. On the left is Ashley. She is our shelter manager, and she's also been with McPaws Shelter for a few years now. We're definitely your go-to people during kitten season while you're fostering. We love to talk to you about scheduling medical exams or surgeries, behavior things, counseling, or anything like supplies needed, or just a simple text just to say hello. You'll see us usually running around the shelter, so you'll definitely see us when you come visit and pick up your first batch of foster kittens. Before we get started, we want to say as a shelter, thank you for being here. Thank you for taking time out of your day to watch this presentation. It's super beneficial to learn all about what McPaws does during kitten season and all the different types of kittens that need fostering. Last year we had 243 kittens walk through our doors, and most of them, if not all of them, went into foster care at some point during their shelter stay. It's super beneficial for the kittens to get out of the shelter, and it's also such a huge help for the loving staff that have to care for them while they're in the shelter. So thank you for being here, and thank you for wanting to be a foster parent with McPaws Animal Shelter. Hi, I'm Ashley, the shelter manager, and I'm going to go over with you why foster, the purpose of our foster program. Our foster program saves the lives of both the animals and the staff. We had 243 kittens walk through our doors just last year, so having fosters definitely helps us. It's just as crucial as adopting because we get them out of the shelter free from disease and also help socialize them for their forever home. Neonate kittens are the most euthanized population in shelters due to the lack of fosters, so thank you for those that are taking in those neonate kittens, and it's just so much cuteness. In this meeting, we're going to go over the different stages of a kitten from mamas and babies up to when they're available to be spayed and neutered, the different types of fostering, and the supplies and techniques we use to have successful fosters. Life stages and the types of kittens we send out to foster. We send out kittens from just born until they are 2 months old. At 2 months old, they are old enough to be spayed or neutered. We also send out older kittens, especially if they need to be socialized. We take in kittens from feral colonies, surrenders, or as transfers from the surrounding area. Sometimes we send out singleton kittens, which are just one kitten, or we send out the whole litter. If a whole litter is too much, we are able to split them as long as they have a friend to go with them. Okay, our youngest population of kitties, which is just born to a 1 week old. These kitties require a specialized type of fostering. If you are interested in fostering bottle babies, we'd love to sit down with you as staff and go over the techniques and routine that these kitties require to live. So this population, they're completely helpless. They cannot see, they cannot hear, they cannot defend themselves, they cannot regulate their own body heat. So they really require a foster parent or their mom to take care of them, which usually in a shelter environment, these kitties come in without their mom. So you're going to play mom while you're fostering these kitties. This means bottle feeding every 2 hours. That means throughout the night. So having to wake up throughout the night and bottle feeding them. This means making sure that they're always warm, they're always comfortable, and also doing a lot of extra TLC things such as stimulating their genital areas so that they can urinate. Again, completely helpless and vulnerable population. Like Ashley said in the past slide, this is the most euthanized, put to sleep population in shelters because of the time and resources it takes to take care of these kitties and the lack of foster parents that some shelters have. So if you're interested in taking on this vulnerable population, again, we'd love to have you on board, and we will do any type of training, any type of resources we can offer to have a successful bottle feeding experience. So more on bottle feeding. So bottle feeding can be a very time-consuming task. This is required for kittens from just born to about 3 to 4 weeks old. It can be a finicky task. A lot of kitties don't understand what a bottle is or a nipple is, and it can be kind of frustrating trying to get a kitty to latch just because it's a new situation for them.
Um, Again, if you're interested in taking on this type of fostering, which there is a huge need for, we'd love to do that one-on-one training for you. And it's a super vulnerable moment. Um, these kitties depend on with their lives on the foster parent. Um, and I will say it is kind of scary hearing all this all at once of how much goes into bottle feeding these bottle babies. I will say foster parents that are trained and have successfully fostered their first litter of bottle babies, they're hooked. That's all they want to foster is bottle babies from now on. Um, I love fostering bottle babies. A lot of staff here love this type of fostering because it's such a nurturing moment for the foster parent or the staff to provide such needed care for this population. So, if you're interested, we'd love to get you started on this population. This little kitty here, her name was Annie. She was so sweet. We were a little frustrated because she was just so finicky with the bottle at first. She didn't know what it was or what the milk replacement was, but the second she finally latched, as staff, we all did a little happy dance, and she was a feeding fiend after that. The bottle was her best friend, and feeding time became super easy after she learned to latch. So, we are super grateful for our foster parents that can take on this population. It's amazing. Our next stage is 1 to 2 weeks old. Same thing, they require just as much TLC. They require bottle feeding. Their eyes and ears are still closed. They don't move around much, so an actual benefit of fostering this population to just born to about 3 to 4 weeks old is they're contained to their cat carrier. They don't need a whole laundry room or living room to foster. So for spacing reasons, they're a great population to take home because they're just in their carrier the whole time where it's nice and warm and safe. Um, but yep, 1 to 2 weeks old. They start to make little cries when they feel stimulated, like if you're petting them or stimulating their area so that they can pee. They start to do little cries and it's super cute. They kind of have little bobblehead shaped bodies, so their body's pretty small, but they have this huge kitten head. And again, bottle feeding every 2 to 3 hours now, so you're still having to wake up throughout the night. Hopefully by this time they understand what a bottle is and feeding time may be a little bit easier for you. 2 to 3 weeks old, my favorite stage. So this is my favorite stage because this is when their eyes start to open, their ears start to perk up, and you're starting to get a lot of little kitty personality growing. So they weigh between 250 to 350 grams. They're starting to become a little bit bigger, about the size of my hand now instead of the size of my palm. Their eyes open. Their eyes open gradually, which is kind of a cool experience to watch once their eyes are opening. And they're always blue when they open. Their ears start perking up and wiggling. They start responding to sound and stimulation. They realize, like, oh my gosh, my foster parent, that's who's been feeding me. And once they see you pass by or they hear you, they start to do little cries and have a lot more interaction with you as a foster parent. They'll start using their mobility, so they'll start trying to crawl around, crawl on each other, crawl around their carrier. Um, but they do still require specialized foster care. You're still bottle feeding at this point and stimulating them to go to the bathroom. But this is a super fun time, especially if you've been fostering for weeks now. And you get to see your little baby kittens start to grow up and become little mini cats. Okay, 1 week later, 3 to 4 weeks old. Such a transitional time period for these kitties. So this is when they start to weigh between 350 to 450 grams. They're about the size of a little miniature kitten now, and we call this group mush babies. This is when their teeth start to emerge, so it's time to transition from the bottle to wet food mixed with water, so kind of a mush texture. It's a super messy transitional period. As you can see here, the little kitty on the bottom, once he realized what wet food was, he was like, heck no, no more bottle, I'm on to this wet food. So we definitely send home a lot of baby wipes and potty pads for foster parents when they take home kittens this age. They're gaining interest in their litter box, so you may not need to stimulate their area so much to go to the bathroom anymore. They're starting to have that innate behavior to want to use the litter box. So this is when we start introducing a litter box. And then their teeth are emerging. That way they can start eating some mush, some wet food, and let go of the bottle. And they become little jaguars. So this is when their personality starts to emerge and they're walking around. They're using full function of all their legs and muscles and they're crawling all over things. They're trying to get out of their carrier now. So it's a super fun time because this is when they are just young little kittens now and growing up so fast.
All right, we're going to move on to the 4 to 5 week old kittens. These guys are my favorite. They weigh between 450 and 550 grams. They are running and walking more confidently. They're becoming more playful and coordinated, as you'll notice. They move on to being mush baby pate babies, which is really nice. And they are perfecting the litter box skills, also really nice for you, less cleanup. This is a simple reminder over here that they're not allowed outside. Please keep your foster kittens inside. Next, we'll talk about the 5 to 6 week old kittens. They weigh between 550 and 650 grams. Their eyes are still blue, but their vision and hearing is fully developed. You'll notice that they're starting to gain those grooming skills. Their heat source is no longer required, but you can still keep it in there for them to be a little comfortable. They should receive wet food and water 24/7, and you'll notice that they're even more playful in this stage. Our 6 to 7 week old kittens, they weigh between 650 and 750 grams. All their baby teeth are visible, which means we can start introducing that hard kibble. They might not be interested in it yet, but it's good to start introducing it. Make sure you're still giving them that pate and water 24/7. You'll notice that they're sleeping less and playing more, which is really fun for our fosters to be able to play with those kittens. And you'll notice that their eye color is starting to change in this stage, which is really fun to watch. 7 to 8 week old kittens are my second favorite stage of kitten. They weigh between 750 and 850 grams, and the reason why they're my second favorite is because this is when they become more independent and energetic. They start to show their individual personalities. Their eyes have fully transferred into their new adult color, and it's an important time for socialization, playing with other kittens, playing with their fosters, playing with their fosters' kids, just so that they are more comfortable with people. It's easy entertainment as well. So while you're socializing those kittens, you're getting that entertainment from them. They're really, really funny in this stage. They are running around, they are exploring, and it's time for that spay and neuter so we can get them adopted out. Yes, this is the sad part of getting them adopted out and you being done with fostering. But the nice thing is there's always going to be another litter for you to foster.
Preventing a catastrophe. We have disease here in the shelter. So before you take home a kitten, each kitten that you take home has received an exam, a vaccine if they're old enough, or any treatment that they needed before being sent home into foster care. If you're wanting to foster a sick kitten that does require medications or treatment, we'd love to know, and we can get you set up with some training on what that kitten needs and how to give them medications or treatments. Here are some things on the left that we see pretty regularly or rarely here at the shelter. We see ringworm kitties. We see panleukopenia positive kitties. We see URI kitties, so upper respiratory infections, which can be pretty common in a kitten, but it is still an emergent thing to let the staff know if your kitten is showing symptoms of upper respiratory infections. We see fleas, ear mites, and worms. We make sure all kitties are clear of that before they go into a foster home. We see diarrhea. Diarrhea can be a very non-concerning thing or an emergent thing. No matter what the circumstances, if your kitty is showing signs of diarrhea or even loose stool, give staff a call. We want to get that treated before it becomes worse. We see hot spots. So sometimes young kitties, they like to suckle on each other like they would with their mom, and that creates hot spots, which can be pretty damaging to their skin and lead to more serious infections. So if you see your kitties suckling on each other, it may look cute, but definitely give us a call. We want to rid that behavior to prevent hot spots. We see just ain't right kitties, so nothing that falls under a category, but you're looking at your kitty and it just ain't right. Let staff know, hey, my kitty usually is a fiend for feeding time. He will eat everything, but this past time, he didn't even want to touch his food. That's super unlike this kitty. Give us a call, let us know. That could be a sign for an underlying illness that's going on. Fading kitten syndrome, for our super young kitties that can't regulate their heat, they can't express their bladder on their own, and they can't defend themselves, we do see a thing called fading kitten syndrome. And I would resort back to your foster kitten handbook to learn more about that. But any of these things that we see here at the shelter, we make sure that they don't get sent home with those things into a foster home. Now, your foster kitten becomes sick while they're in your foster home and in your care. What do? First, if we are open, give the shelter a call. That's the fastest way to reach a staff member to help you with a sick kitten. If not, resort to your foster handbook that you received. There's an emergency call list. If we are closed and it's after hours and it's an emergency, you can call the staff numbers that are on there. They're always willing to call you back, text you, or anything like that to provide help after hours if we are not open at the shelter. So here are some things that you may want to get a hold of a staff member pretty quickly. You're seeing discharge from the eyes or nose or difficulty breathing. You're seeing your kitten is cold to the touch, which shouldn't be the case. If your kitten is feeling cold, they're probably internally cold, and we want to get a heat source on them, and we want to get medical attention on them fast. Any combination of diarrhea, vomiting, lethargy, or refusing food. Kittens that know how to eat and eat well, the second they're starting to refuse food, we need to double check because that could be an underlying illness that we're not seeing. So, they're straining to urinate or defecate, give us a call. Any bleeding, even if you don't know the source and you see some blood marks like in their kennel or on their towel, let us know. We want to make sure that our kitten is not actively bleeding. That can be pretty emergent. Any abnormal twitches or neurological symptoms? Twitches like kind of the whole body twitches, something that maybe resembles a seizure-like episode, or any neurological symptoms like they're wobbly on their feet all of a sudden, they are not acting the same like they used to, things like that. Again, sudden change in behavior. Hey, my kitten decided to not want to eat breakfast, which is super unlike him. What's going on? Or slumping over food and water dishes. So that slumping where they're just so tired, so lethargic, where they don't want to eat, they don't want to play, anything like that, that falls into kind of the fading kitten syndrome. And of course, anything like that, give staff a call and try to get a hold of someone. When things like that happens, we usually have you bring the kitten in so that our team can look at the kitten and provide any treatment that's going on, or we just do an over-the-phone consult to see if it's emergent and they need in right now, or if there's some things at home that you could use to take care of the kitten until we can get that kitten in here at the shelter. So usually a pretty rare thing when a kitten becomes sick in foster care to where it's emergent. Like I said, all kittens that go into foster care, we like to make sure they're healthy and happy before doing so.
We have our usual supplies that we provide for our fosters, so you don't have to worry about having all these supplies yet. When you pick up your first litter of kittens, you'll have some supplies, and you can keep that until kitten season is over. So we will provide you a kitten carrier or a pen or both. This is to help with transport between your house and here at the shelter, whether they need to come here for medical care, vaccine updates, or they're ready to come in for their spay and neuter. We'll provide you with a heat source if they're the younger kittens, and that heat source is either one of these heat discs or it could be a heated blanket, heated pad. We'll give you some food, kitten milk replacer, KMR, for those baby bottle kittens. We also have pate and hard food. We can give you all three for all stages. We provide bowls, litter pans, litter, blankets, towels, any sort of bedding that these kittens need. Toys as well. We give out toys for those older kittens, but for the little babies, we do give them a stuffed animal that kind of mimics a mama with a heartbeat inside of it. We'll give you those bottles, nipples, and wipes. Also, we'll send you home with gram scale so you can monitor their weight gain as they're eating. You'll weigh before and you'll weigh after. Cleaning supplies, we'll give you wipes, paper towels, rescue disinfectant, which is what we use here in the shelter for disinfecting. Got other ideas for supplies in your home? Let us know. Anything helps us will help you. Medications and medical supplies for our sick babies we do provide as well. If they're on medications or they are on special food or anything like that, we will also provide. We have different fostering for you to choose from expecting mothers all the way until they're adopted and beyond. Expecting mothers need a little comfortable, quiet space before they give birth and after. Those are really easy to foster as well because the mom pretty much takes care of everything for the babies and herself. You just got to make sure she's eating. Our feral colony kittens are a little bit more skittish and afraid of humans, so having time to socialize those guys, it's really, really fun to watch them blossom from this really scared kitten to one that just wants to play and be with humans. We also have our medical kittens, from ringworm to something ain't right, kittens awaiting spay and neuter surgery or adoption, and when we need that space. We're a small shelter, so having you as a foster is really important for us to be able to continue to keep taking in these kittens. Like I said in the previous slide, expecting mothers are the easiest ones to foster. They pretty much do all the work for you for the babies. Mama needs access 24/7 to her food, water, and her litter box and her babies. The reason why we want her to have access to food 24/7 is because she is feeding those babies. She needs those extra calories to make those babies big and strong. You want to make sure she's in a nice quiet space in the home, whether that be her own room or your bedroom where there's not a lot of traffic, just to keep her stress levels down. You want to observe if there's any changes in the babies, whether they're not latching on to mama or mama's not going to her babies or anything like that. That's when you'll give us a call and we'll help you there. But these are super easy. You kind of just let her do her thing and the babies grow up. And after they are weaned, we go ahead and spay the babies and the mama so she can retire happily.
Like Ashley said, we like to send out our antisocial kitties. These are kitties that are from a feral colony or from outdoors and just never were socialized. And we like to place them into a foster home with a foster parent that can counsel and provide that one-on-one time. You can see here we have some unhappy kitties that are unhappy to be at the shelter around humans. So we really benefit from foster parents that want to do that one-on-one socialization so that we can send them to a adoptive home where they can be indoor, possibly outdoor kitties that are happy with humans. Another categories are medical care kitties. These are kitties that aren't available for adoption because they need treatment and care for the disease or illness that they are going through. A big one is ringworm kitties. Another one is upper respiratory kitties, or kitties that are just not doing great in the shelter environment and need some type of antibiotic, medication, or extra TLC while in the foster care home. Again, this requires some specialized training. So if you are interested in taking care of a medical kitty, give us a call and let us know, and we would love to set you up and do training with our staff. This is a fun group to foster because you get to provide a little bit more in-depth TLC for these kitties and watch them get over their illness. Our biggest group that we send out to foster are kitties that are awaiting their spay and neuter surgeries. So here at McPaws, again, they have to be 2 pounds and 2 months to undergo a spay and neuter surgery. And so these are kitties that are just right under that check mark that need to get out of the shelter for some socialization, some TLC, and to gain some weight to make that 2 pounds so that they can be fixed and then ready for their new adoptive homes. Okay, you learned about all the different types of kitties that we send out to foster. So how do we get started? First, let us know what type of kitties you're interested in fostering, whether that's bottle babies, antisocial kitties, or kitties that just need to wait for their spay and neuter surgery. Contact us. We love being there for advice and counseling and getting you set up as a foster parent here at McPaws. You can contact us via email at frontdesk@mcpaws.org, or you could just give us a call and one of us will talk to you and get you situated with fostering. What you'll get once we have foster kittens that are ready to leave the shelter, you'll get kittens, of course. You'll get supplies, whatever supplies you would need in a foster home. And then guidance, what this kitten or kittens need in their foster care to have a successful foster experience.
Before you take home your kittens, we want to make sure your home is ready. We want to have them indoors in a nice, quiet, comfortable space in their own room or area. We want to make sure there's no escape routes. Kittens can easily get into the smallest areas, so get down on kitten eye level to see what they can see in those cracks and crevices. We want to make sure we put those hazards away, put the toilet seat down. Kittens can get into things you wouldn't even expect. We want to make sure they don't have any contact with other animals in the home. This is because they aren't fully vaccinated yet, so their immune system isn't fully developed, and this is just for the safety of the kittens. And you want to make sure it's in a clean, sanitizable area. Kittens are pretty messy with the pate, with their own litter box and all that good stuff. So you want to make sure it's in an area that's easy for you to clean. We are going to send you home with rescue to help keep that sanitized. We do weekly checkups, whether that be a call to you or coming into the shelter. If you're coming into the shelter, we're doing vaccinations and examinations if they need it. We are also doing weight checks to make sure that they're appropriately gaining that weight and not losing any. We also call, or while you're here, check to make sure you have all the supplies, litter, food, toys as well if you want to switch out some toys. And if you needed any foster support as well, you can give us a call anytime for that. We also will let you know what day and time for drop-off is for those spay, neuter, and adoptions going on. And if you need any medications that need to be refilled, give us a call, or we will be calling you to make sure that those are doing okay.
Okay, the hardest part of fostering. Your foster kitties or kitten is ready for adoption. That means that they've been spayed or neutered, they've been vaccinated as much as they can, they're healthy and they're microchipped, and they're behaviorally ready to find their homes. So now it's up to the shelter staff to find their forever homes. This is when you drop your kitties off and you say farewell, and then the shelter staff takes over and gets them ready for adoption. Once your foster kitten is adopted, it is bittersweet, of course, because you've spent so much time with these kitties and you've helped them grow. It's time to clean up and get ready for your next batch of foster kitties. Please remember that fostering saves lives. You're providing a home, a space, time, quality time for these kitties so that they can grow up and stay out of the shelter environment while they're getting ready to be available for adoption. So again, remember that you're saving lives by being a foster parent, and it's also a super fun thing to watch them grow up and find their forever homes, and then get ready for your next batch of kitties to foster. So thank you for watching this. If any thoughts or questions or simple comments came up throughout this presentation, please email us or give us a call, and we'd love to guide you and answer those questions. Thank you again for taking time out of your day to be here and getting started with being a foster parent for our kitten season here at McPaws Animal Shelter. We look forward to working with you and hearing from you. Thank you again for being here. We appreciate it.